Welcome to Saturday Spotlight this afternoon on Newstalk 1130 WISN. My name is Dave Michaels, spotlighting something you've all seen many times, whether you live in Pewaukee, New Berlin, Mukwonago, and all points in between. You've also heard their spots here on Newstalk 1130 WISN. I'm talking about OAW, Orthopaedic Associates of Wisconsin. Happy to be joined in studio this afternoon with one of the medical professionals at Orthopaedic Associates of Wisconsin, Dr. Chris Kilian. Dr. Kilian, how are you?
Doing well. Thanks for having me.
OAW, it seems like it's been around much longer than it has, but it's relatively a new entity here in southeastern Wisconsin. We'll get to your background in just a second, but for those who might not be aware, how long has OAW been serving southeastern Wisconsin?
Well, it's been, I should know the exact amount of years, but I don't. But it actually has been around over 50 years.
It has?
It started out as Orthopaedic Associates of Waukesha. They're kind of a Waukesha-based group and still kind of centered in that area. But it has been around for many years. But we've certainly evolved and grown and progressed more rapidly, I guess I would say, over the recent years. Some of our more senior guys, they are around pretty close to the start of it. They're, in our current location in Pewaukee, Delafield there, we opened that building about 9 years ago, and before that in Waukesha itself.
All right. OAW been around now for almost 5 decades. What about yourself? Where are you from originally, Dr. Kilian?
So I was born in Chicago, but I grew up in West Bend. So I'm West Bend East grad. So lived most of my life there, most of my life in Wisconsin, and then and it bounced around a little bit ever since then.
But you're from Chicago. I'm guessing that means you are a Bears fan.
That is correct. I am a Bears fan. Also a Cubs fan, but I do cheer for the Brewers, but just can't really cheer for the Packers. But,
all right.
Yeah.
Well, let me put it this way. You said Brewers because you know who they play on Thursday, opening day. That being the White Sox.
Yep,
so I assume you're on Team Brew.
Yeah, I'm cheering for the Brewers for that. Yep, exactly. I'm not really much of a White Sox fan, but so I'm definitely cheering for the Brewers in that situation.
I will never take any exception for Bears fans because my grandfather was born in Green Bay. But at a very young age, we're talking under 1, moved to Chicago, the south side of Chicago,
Sure.
95th and Cicero area.
Yep.
He stayed a Packer fan because
That's
he was
pretty
born
impressive.
in Green Bay. And this was in some really lean years here.
Yep, that's kind of how, I was born in Chicago, but grew most of my life here, but with my family being Chicago people, all the stuff, so I stayed a Bears fan.
And it's hard not to be a Bulls fan, considering I'm guessing
I was a
you
90s kid.
Exactly.
I mean, Michael Jordan era was the best.
And for those of us, I assume we're around the same age. Yes, the Bulls were the dominating team in basically all the 90s.
Exactly.
At the end of the day.
Great to grow up during that. So
enough about Chicago versus Milwaukee. Let's talk southeastern Wisconsin and OAW. It's not just for athletes. Obviously, OAW serves many athletes, young and old, but it's something that is available to anyone who has any kind of questions or concerns when it comes to getting expert analysis on if and when surgery makes sense. Who would be the target audience of OAW patients?
Yeah, absolutely. So, we do cover the whole spectrum of orthopedics. One of the unique things about our group is every surgeon in our group is fellowship trained, which means that we kind of subspecialize kind of in our area of expertise is additional training beyond the standard orthopedic surgery residency. So we're all subspecialized, which means you kind of get expert care in all the fields. So we cover, people that need joint replacements. We cover the athletes, the football players. We cover, a lot of the sports teams in the area, especially football. We're on-field physicians for Arrowhead, Mukwonago, multiple schools. So we take care of those athletes. We take care of people that need joint replacements. I specialize in shoulder surgery, so a lot of people that need rotator cuff surgery, shoulder replacement surgery. Also, the younger people that have instability or whatnot in their shoulder. So we take care of the whole breadth of it. And we have spine surgeons, hand surgeons, foot and ankle surgeons. We cover orthopedic trauma. We cover the pro health hospitals. So we're like Oconomowoc Memorial, Waukesha Memorial, and Mukwonago as well. We cover, we're the exclusive orthopedic provider. So when someone comes in with a broken bone, probably the most common thing we see on call is elderly hip fractures. When grandpa breaks their hip, or sometimes even a little younger, we're on call and we fix that while they're admitted to the hospital. So that's probably our more common case while on call.
You mentioned kids, the high school basketball season winding down. Of course, March Madness in full effect
Absolutely.
On the collegiate level. Are you seeing more and more young athletes come in because of things that maybe could have been prevented, but they Was the necessary precautions taken? Obviously, injuries can happen at any time on a football field, basketball field, even pickleball court. But are you seeing more and more young athletes?
A fair amount, for sure. I mean, there are a lot of, thankfully, that even just the field of like physical therapy is advancing a lot, and there's a lot of things that can be done for injury prevention. And we have multiple physical therapy locations, including a sports facility in New Berlin, our main location, Pewaukee, Brookfield. We're going to have a new one out in Johnson Creek soon. We also have a Mukwonago location. So physical therapy can be very useful in hopefully preventing a lot of these injuries where sometimes you just work on their mechanics, making their muscles stronger. All those type of things can really help a ton to prevent those injuries.
And this is at an age where advancements have never been greater when it comes to coaching and, like you said, experts like yourself, even training going into the season. The days of showing up on a football field in 1974 and getting in shape for the season long gone. Now. Again, this is a broad question. Everything can be focused on a case-by-case basis. But as part of the issue with young athletes, especially having major health issues, major issues that you encounter, is because they're playing too many sports. I think the days of just focusing on one sport long gone. So in other words, they're putting too much stress on some of the items you just mentioned.
To a degree, yeah. Yes and no. So there has been actually a fair amount of research showing, especially in baseball more than anything, probably it is good to be a multiple sport athlete and give your body a break in terms of repetitive motion in the same way. So especially in throwing athletes, pitchers especially, those arm injuries, it's really been shown actually to have multiple sports where you're giving your body a break from that throwing motion especially is good. So it depends on what we're talking about, certainly, but to a degree, especially like, football, people are subspecialized or, get into that pretty early, and certainly that can cause some injuries as you go. Obviously,
we use Micah Parsons as an example. The Packers tore his ACL, non-contact injury.
Yep.
Is there anything parents can do? Because, again, sports seasons are never-ending, 12 months of the year. Even when you're not in season, you're in the weight room. You're training because of the competitiveness of high school athletics, especially in our area. Is there anything parents can do to minimize? There's never a guarantee, but minimize the likelihood of some of the things you mentioned happening to their son or daughter who's a student-athlete?
More than anything, if there are certain people that maybe are a little bit more at risk, and you mentioned football. Sometimes actually young female like basketball players are real and soccer players too for ACL injuries, and there are a lot of preventative programs, specifically ACL programs, that again, when you work on how they jump and land properly and strengthening their quad muscles properly, all those things can actually really prevent those injuries from happening in the first place.
When patients come in, do they need a recommendation from their own medical provider before they see an expert at OAW, or can they?
Usually not. So our main location in Pewaukee and also in Brookfield, we have a walk-in clinic. So it's so if you have essentially a new problem, you can walk in at any time and be seen by a provider. The nice side of that is that it's not like it's not billed in the same way that an ER visit is, which is much, much more expensive with an ER visit. So it's much cheaper to do that way, and you're getting to see an orthopedic specialist kind of right away. Sometimes we do have a PA or NP that's working that clinic. Sometimes if it's more significant, like a broken bone or whatnot, they'll pass it to one of the surgeons right away. So you can be seen right away for that and not have to go into an ER. In terms of, you can just book appointments with any of us. There are some insurances, specifically United recently, which is requiring these referrals from their primary care doctors ahead of time. That's a new thing actually within the last year, which some listeners are probably aware of and we're dealing with, unfortunately. But sometimes they do require that referral from their primary care provider, which is a new thing, purely insurance-based, not because we want that or anything. But most insurances, you can just book an appointment at any point with any of us.
I know a lot of people are hesitant to reach out because it's an admission that they might be getting older. But now that, as another example, golf season is right around the corner, finally a decent day today after the crazy weather we had Monday, but the week before that, it was in the 70s.
Yeah.
All of a sudden, you swing those golf clubs a little bit, and that discomfort that was in your shoulder last golf season might be there again. You can ignore it, but in reality, it might not be a bad idea to get some information.
Yeah.
You mentioned broken bones. Obviously, see someone right away, be it the ER or OAW. But if you're concerned that whatever nagging pain, wherever it is, isn't going away, How does that process start if you want to reach out to the experts at OAW? Should you do that online to book an appointment? Can you walk right in?
You can essentially do all of the above. You can do it online. You can call, so you can book an appointment through our online, just our website, which is orthowisconsin.com. You can call our office. You can just walk in. You might not be able to be seen exactly by the person you want to necessarily if you do the walk-in clinic visit, but they can at least get you then kind of scheduled then later if there's a recurrent issue. Sometimes they'll get the process started. Like if you have something more significant where in my world I see obviously mostly shoulders. You've had this nagging pain, your decreased range of motion, new weakness, those type of things. Sometimes you'll come in through our walk-in clinic. We'll start with x-rays. At times we'll end up getting an MRI, and then you see me after you get the MRI. So we can at least get the process started, which is really nice. And I will say, especially with golfing or especially in my shoulder world, there are things that can be time dependent. When people, especially have a new injury, like a rotator cuff tear is probably the most common thing that I see. Some rotator cuff tears are time dependent because when that tendon tears off the bone, off your humerus bone, it pulls back and the muscle that it's connected to starts to shrink down and atrophy. And actually it can get to the point where the muscle and tendon cannot be repaired if it's been there for too long and it shrinks down too much. So there are times when it is very time dependent and you want to be seen sooner, especially if you've lost range of motion or new weakness or those type of things.
Dr. Chris Kilian here joining us this afternoon. It's Saturday Spotlight focusing on OAW, Orthopaedic Associates of Wisconsin. We'll discuss what makes OAW different next on Newstalk 1130 WISN. As we continue our conversation this morning with Dr. Chris Kilian from Orthopaedic Associates of Wisconsin here, it's Saturday Spotlight on Newstalk 1130 WISN. You've driven by the OAW location in Pewaukee. Of course, the relatively new one there in New Berlin with locations in Mukwonago, Brookfield. New location in Johnson Creek. When's that going to be?
So we're building a new facility in Johnson Creek. The clinic itself should be open at the end of this summer, 2026. So end of August-ish, and then we're also going to have a surgery center there, similar to what we have in our building in Pewaukee. The surgery center should be open in the fall time, and we'll also have MRI and physical therapy at that location as well.
I've been in the location in New Berlin. What I've noticed, and you can confirm this, Dr. Kilian, what helps OAW stand out from your competition is everything is under one roof. It's really a one-stop shop, isn't it?
Yes, correct. Yeah. So especially our main facility, we like the kind of the Pewaukee location just off of 94 and Highway SS there, in town of Delafield technically. But we have over 40 clinic rooms. We have six rooms of operating room space, physical therapy, MRI. We have a DME brace store. So basically everything is there under one roof, which is very unique, I would say, within the medical field and orthopedics in general. So we're, it really is that kind of one-stop shop for our patients, which is a nice service that we can provide. And I would say we get very good feedback from our patients that it's so much better than a lot of other settings where it's not as cohesive.
And there's a lot of non-surgical options as well. Look, surgery is, I won't go as far as say last resort, but that is just one of the many options. OAW does not want you to go under the knife. They want what's best for you.
Absolutely.
And you're able to accommodate that because of the fact that, like you just mentioned, everything is there in one location.
Exactly. And we really do try to maximize the non-operative treatment. There's a lot of people that come in who even come in expecting or wanting surgery that at times I'm kind of convincing them that they don't need it because there are other options that have a very good chance of making them better without surgery. Sometimes it's physical therapy. Sometimes it's, light medications, or sometimes it's a cortisone shot, or there's things like called PRP, platelet-rich plasma, different treatment solutions that you can at times completely avoid surgery that we very much try to maximize and optimize for our patients.
Is that psychological or maybe generational? Level of pain. Bad pain, must have surgery. Less pain, well, physical therapy. I don't want to oversimplify it, but is that where that mindset comes from, where surgery, they believe, is their only option because of the level of pain?
Yeah, to a degree. And sometimes we are prolonging a surgery. Sometimes people with like terrible arthritis, yeah, we're probably eventually going to get to a joint replacement. But there are things that, if timing doesn't work out right for them, or there's sometimes they might never need it. We try to maximize it, but it depends on what the patient's kind of expectations are, what their degree of pain is, and again, whenever we can maximize non-op, we definitely do.
Dr. Chris Kilian from Orthopaedic Associates of Wisconsin here at Saturday Spotlight, News Talk 1130 WISN. If you missed our conversation earlier this hour, your specialty is shoulder replacement and rotator cuff.
Mm-hmm.
In your time as a doctor, I'm sure you've seen many advancements. Really more than ever before, now is just a great time to be in your line of work because of the medical advancements that society has been able to experience. So talk a little bit about what you saw when you first got into the field compared to now.
Yeah, absolutely. So I've been practicing for almost 9 years now. Did fellowship before that and orthopedic residency for 5 years before that. In terms of the advancements, number one, rotator cuff surgery and shoulder replacements are the two most common surgeries I do. Rotator cuff surgeries has evolved where we do the majority of it arthroscopically, so small little poke hole incisions, where you don't need as big of a scar, big of an incision, lower infection risk, and we can fix it all through the scope through a little
quicker
camera.
Recovery time too.
It really does make the whole process a lot easier doing it that way. Additionally, probably the biggest thing since I've been in practice, specifically for shoulder replacements, there's still only one or two companies that have this technology, but we do a navigated shoulder replacement surgery. So what that means is when we do the surgery, we get a CT scan on everyone's shoulder that shows us the exact bony anatomy of the patient. I put that into a software program. That program gives me a 3D picture of their shoulder blade. I will plan then exactly where I place the metal components on their exact bone. That plan, it's not just the planning. That plan then comes into surgery with me. We have a computer screen essentially at the end of the bed. I put a little tracker on their bone, and then there's a tracker on my instruments. So when I move my hand during surgery, I can see exactly where it's moving on their bone, and then it gives me kind of like a bullseye and a target where I should be drilling and reaming and doing all the things that I do so that I can place the components exactly where I planned ahead of time to place it. Because when you're looking deep into a shoulder, you're only seeing a little bit of bone. Now I've got a 3D plan and a map navigation on how to do it. So it's computer assisted or accurate when we place some of the components, and which ultimately leads to better outcomes, and you're doing exactly what you want to do, and it kind of eliminates a lot of the guesswork.
And it eliminates a lot of not just risk, but also forgive my novice terminology, poking around in places where you don't need to, which increases the likelihood of less recovery time, less pain.
It's
still shoulder surgery.
Still shoulder surgery, but it just it's one of the few what I would call it kind of like a game changer type of situation where it's truly making the surgeon better.
And this is unique to OAW.
There are other groups that do use it. I don't know, very few in the area, but it is available with the company that we use. But there's not a lot of surgeons that do it. But all the surgeons at OAW do use this technology, and again, it just makes us better.
And what do you ultimately want your patients to get out of an experience with Orthopaedic Associates of Wisconsin? It's not just the surgery, it's the entire process. When someone says goodbye, whenever that may be, what do you want them to take away from the overall experience?
Obviously, we want them to have the best experience and best outcome possible. Obviously, we're outcome driven, especially if, whether it's surgery or surgery or no surgery, you want to maximize their outcome and make them better and make them be able to get back to the things that they want to do. And that's what, oftentimes when is the decision to do a shoulder replacement or a hip or knee replacement? It's when the pain and the disability is unacceptably altering your life. And the goal of surgery or non-surgery is to get them back to the point where they can do the things that they want to do again. And you want to have the best experience during that possible, which is, again, unique to us as far as everything right at one place. Again, so many people that are just thrilled to have all of it right there, and it just streamlines the whole process and makes it easier for the patients.
To learn more about Dr. Kilian or any of the team at Orthopaedic Associates of Wisconsin, we would encourage you to go to orthowisconsin.com. That's orthowisconsin.com. Fascinating conversation. Appreciate you coming in this afternoon and sharing some time and, more importantly, your insight, Dr. Kilian. Thank you much.
Thanks for having me. Appreciate it.
More of Saturday Spotlight next on News Talk 1130 WISN.